Broadcasting from Park Avenue West, you're watching WMFD Television, Channel 68.
Maybe an hour after we got the message that we lost Danny, Danny's sister said to us, we were all crying, and she says, "What do we do? What do we tell people?" And I'm like, "Baby, we got to tell them the truth. This is nothing that can be hidden, because otherwise the suicide will win."
We're not mental health professionals. It's just something that happened to our family. We direct people other places. And most important of all, I think, don't quit. Keep fighting. Keep living. Things will get better.
Good evening, and welcome to another episode of Sparking the Conversation. We are Jeff and Donna Heck with 33 Forever, and we are so excited to be able to bring you our weekly half-hour messages, stories, and resources surrounding mental health topics and challenges. Our show's purpose and hope is to provide both information and inspiration, making conversations about mental health the norm.
Our guest tonight is Dr. Johanna Wilson, MD, the principal of Hope 419, Psychiatry Counseling TMS Treatment Center in Mansfield, Ashland, Norwalk, and Worcester. Dr. Wilson is a board-certified psychiatrist with over 11 years of clinical experience. She's also a member of 33 Forever's Professional Advisory Committee. Dr. Wilson provides, and her practice provides, a wide range of psychiatric services for both adults and adolescents, including diagnostic, medication management, and psychotherapy services. Welcome back. You've been on our couch before, but welcome back to Sparking the Conversation, Dr. Wilson.
Yes, thank you. I'm so glad to be back.
We appreciate you coming back. And we talked to you about this a little bit ago, that we wanted to sort of do some episodes where we focused on specific mental health issues and disorders and conditions. And you came up with, actually, as we were talking to you about it, an interesting one that I don't necessarily even think of as a mental health condition, but obviously it is, and that's attention deficit and hyperactivity disorder, ADHD, which we talk about consistently. So let's talk about that tonight. Why is it really a mental health disorder? Why is it categorized that way?
Yeah, well, apart from the main reason, it being in the what we call the Diagnostic Statistical Manual of Psychiatry, it is a disorder that actually affects people's day-to-day life a lot more than what we realize. And I think we as a society think of it as a childhood disorder, maybe that people outgrow it. But what we're seeing in the research and in our clinics is that there are many adults seeking out services with the question, is it possible that I could have ADHD? What we're hearing people come in and say is, I read about this on Google or TikTok. I happened to look last night at the number of TikTok hashtag ADHD views was 11.2 billion.
Oh my gosh.
So it is trending.
Goodness,
people are
yes.
interested in what does this really mean? Could I have it? Is this what's disrupting my life? And so when you came to me and asked, what could we talk about? I thought, let's talk about something a little different, but it's also impactful.
It is. It's a tremendous subject that we never would have thought of. And in my Google search, over 3 million U.S. cases of ADHD are diagnosed a year in the United States.
Yes, in fact, there have been some pretty large studies comparing the trends in ADHD diagnosis and what they're finding now compared to in 97, 98, we were at about 6% of the total childhood population being diagnosed, and that actually increased to about 10% in the 2016-17 year. And so that's a pretty drastic increase. That's 10% of our childhood population with parent-reported diagnosis of ADHD.
Is that I know it's not you can't diagnose, you can't answer good to bad, but is that a good thing because people are aware of it, or is it a bad thing because, there's too much going on in our world that's making us, not be able to focus?
Right. There's a lot. That question comes up with a lot of psychiatric illnesses. Are we recognizing it more? Is it happening more? Mm-hmm. And I think truly people don't have a good answer for that. I do know that the adult population that we're seeing being affected is definitely much higher, and the estimate is about 6% of adults. It used to be when I was in residency, when I did my training, ADHD was something that children outgrew, and you'll still see that. Some of the studies say that really what's happening is that people are learning to cope with that neuropsychiatric illness because it's really something that you're born with. It's a biological deficit of neurotransmitters that is present upon birth, manifests prior to the age of 12.
I think that's one thing that's very interesting is I think people say, well, what causes it? And is it because my kid's looking at screens too much early on in their lives, or is it, but what you're saying is, and the things I read, is that there's a lot of genetic background to it. And there are also things like, drinking alcohol or smoking when you're pregnant or low birth weight or premature stuff. But those are the kinds of things that there's a better understanding of that than previously.
Right, yes. It's highly genetic. So it's actually 50% chance if you as an adult have ADHD and you have children, there's a 50% likelihood that your child will have it. What's interesting is that we often see the reverse. We get a child that's diagnosed by a pediatrician, there's school problems, and because it's more mainstream and recognized now, the parents come in to me as adults and say, now these are all things that I remember dealing with as a child, and in a lot of ways, they're still affecting me now.
Yeah.
Interesting.
Yeah.
Is the fact that it's diagnosed so early, that's different from a lot of mental health disorders. You don't normally diagnose a child with anything because it takes a while for the brain to develop.
Right, sure. So there is a subset in the DSM of diagnoses that we give to childhood age patients, and ADHD is one of them. And in fact, without those symptoms prior to the age of 12, we can't really make that diagnosis. So if a person says, well, this just started happening in my mid-20s, we say, well, then there's probably something else going on.
Right. We've got a lot of things to cover here. We do have to take our first break, so we're going to be back in just a minute with Dr. Johanna Wilson here on Sparking the Conversation.
Welcome back to Sparking the Conversation. We are here with Dr. Johanna Wilson of Hope 419, and we are talking about a very interesting subject in the mental health world, ADHD, which is the acronyms for Attention Deficit Hyperactivity Disorder. That affects, based on your information already that we've had that I'm just zoned in on, how does this affect the quality of life of people diagnosed with that?
Right. Well, the best way to describe that is really to review the symptoms of ADHD. And there's a pretty large list, actually, of symptoms. So there's a lack of attention to detail, forgetfulness, disorganization, really procrastinating, avoiding the things that they know are going to take a long time. So as you can hear me saying, a lot of these things would be problematic in the workplace, academically. And then if you look at the list of hyperactivity or impulsive symptoms, you're going to see the fidgeting, running about, talking excessively, interrupting people, having difficulty awaiting your turn. So there are things in society that make this diagnosis kind of stand out if a person has these symptoms. So oftentimes people with ADHD will get feedback about being lazy, not doing the things that they're supposed to do. And actually there's a lot of research that says that children with an ADHD disorder will actually get a tremendous amount of negative feedback over their lifetime compared to a child without ADHD. So if you're thinking about just running about, talking excessively, there's always the sit down. Why can't you be quiet? The why are you so disorganized? And that negative feedback that they're hearing can affect a child's self-esteem and and that's during the kind of years where you're developing your confidence, your sense of self. So we see a high comorbidity of depression. We also see anxiety disorders associated with this. So if you're always forgetting something, if you always are running late, the kind of key things, disorganized, your thoughts are kind of all over the place, you're constantly distracted. There's this constant thought process at the end of the day. What did I forget? What didn't I do right? So there's that anxiety that's associated with that. And also what we'll see is a high comorbidity of antisocial personality type. So a lot of people with legal histories, people in the jail system have a diagnosis of ADHD that they started off with bad behaviors as a child, got a lot of that negative reinforcement, and just kind of went with that. This is who I am. This is who I'm going to be. This impulsive kind of character.
Can you intercept that? As a, let's say even as a teenager, if you see this with your child and you didn't realize it was ADHD or something like that, you just thought, oh, my child is just will not listen. You spent all day in his room, but can it be helped that you could change the whole trajectory of their life?
Absolutely, yes. And oftentimes when we have young people come to us, we screen for ADHD as a part of their full assessment, but that's not generally what brings them in, especially in adolescent years. We see more depression, anxiety, poor academic performance, maybe even some, reading disabilities, things like that. And then when we dive deeper, we find that there's a potential for an ADHD diagnosis, and we encourage parents, maybe this is the missing piece. They've tried this medicine or that medicine for anxiety or depression, and we're just not getting there. We're still having these problems. Maybe we need to test for ADHD.
I mean, it sounds like the diagnostic process can really occur at multiple different times in somebody's life, and it may be early, it may not be early, and that can affect things. So, diagnostic wise, how do you kind of figure out that somebody really kind of fits that profile?
Right. Well, pediatricians are on the front line for doing a lot of this diagnosing in childhood. And typically, we need to see that these symptoms exist in two settings. So it's not just at home. It's not just behaviors associated with some kind of chaos or something going at home, but we're also seeing it at school. So we will administer Vanderbilt, is what they're called, Vanderbilt assessments, which is a checklist of symptoms that can be given to the parents and to the teachers. They come back to the clinician, and then we can assess from there. As they age and get a little older, and there's anxiety and there's depression and there's maybe trauma included in there, and we need to really kind of be sure that we know what we're treating, there are more extensive tests that can be done where we have observers, parents complete these assessments, the patient or the child themselves completes the assessment, and sometimes we do in that situation have teachers involved as well, or somebody else that knows the child well that can show how they perform in another setting.
But you would not test every child that comes into your office.
Correct. Sometimes sitting with a child, giving their parent an assessment, their teacher an assessment, and spending an hour, especially the hyperactive, impulsive type kids, we can see that pretty easily. It's the inattentive ones that get missed, and oftentimes females tend to have that more inattentive presentation. And what we'll hear as when a female age 19, 20 comes in, they had a brother who was the hyperactive type, and so they got overlooked because their behaviors weren't the chaotic ones that were getting all the attention. They were maybe the kid that was zoning out, getting C's in class because they weren't interested, not because they're not intelligent, but just because their mind is elsewhere. Yeah. And even high achievers who are really bright, they can kind of surpass all of that attention deficit problems and still function well, and it gets missed until maybe college when things start getting more difficult and the IQ doesn't surpass all of the deficits.
Right. This is just absolutely fascinating, but we're going to have to take another break. Stay with us and we'll hear more about ADHD.
Welcome back to Sparking the Conversation. We're here having a great conversation about ADHD with Dr. Johanna Wilson from Hope 419. And Dr. Wilson, the conversation's been amazing, actually. We've learned a lot. I hope our audience has too. But one of the things that I think is important that we make sure we talk about before we get out of here today is treatment. What's the best way to help somebody who gets through that diagnostic process, and what's the best way to help make a difference in their life?
I'm so glad you asked that question, because I think that's the sticking point for a lot of people in society's thoughts about treatment and treating ADHD. There's a lot of misnomers out there. One of the main things that I will get asked, well, isn't my child, or aren't I going to become addicted to this? The most important thing that I tell people when I hear that question is that the studies show that people with ADHD have a really high likelihood of having a substance use disorder. When we treat those people with ADHD medications, that likelihood reduces back to the normal population.
That's
So
huge.
That is.
there's this thing called dopamine chasing, and anybody that watches anything on TikTok will see, because that's terminology I'm hearing my patients use. They are looking for the thing that is missing in their brain without knowing that that's what they're doing. So the substance use, the smoking, the cocaine, the marijuana, they are doing it to kind of replace what is actually missing. So if we treat with medication from an early age, or when it's diagnosed, whenever that may be, quality of life significantly improves. And it's been one of the most rewarding things, and very surprisingly rewarding. Like, if you would have asked me outside of residency, are you going to feel a sense of reward from treating ADHD? I would have been like, I don't know, maybe more so depression and anxiety. But the medications work so quickly, they're so effective, that if a person can tolerate the small amount of side effects that there are for most people, it is a remarkable turnaround. They'll come back in 2 weeks and say, wow, is this kind of what normal people function like? Is this how normal people's brains function, that they can... And they fall asleep easier because they're not ruminating about the things that they didn't do right that day. Their anxiety is lower because they see a task, they see a problem, they approach it, they fix it, and they move forward.
What an amazing blessing for somebody who's been suffering with that feeling in their head, even as a little kid, and the difference you can make in a small child, let alone an adult who's had this.
Right, exactly.
And how many people have we missed with that diagnosis? I mean, now you said adults are coming in with these thoughts that maybe something is going on with me.
Yeah, absolutely. And that's why screening for ADHD is so important, because it has the chance to look a lot like bipolar disorder. There's that impulsive component. There's a lot of mood dysregulation, so irritability, temper tantrums. So oftentimes people will come in and say, I wonder if I have bipolar. And that's a little light bulb for us to say, okay, we know what masquerades as bipolar disorder. Let's look into that a little deeper. How did you perform in school? What were your behaviors like?
There's some things that are in addition to, or maybe supplemental to, medication as well, aren't there? There's some behavior modification things and ways you help families deal with it as well.
Absolutely.
What's that look like?
So important, because the medications are time limited. Many of them last about 7 to 8 hours. Well, you still have the rest of your day, and they're kind of out of your system. So learning how to break things down into smaller pieces, learning the things that are difficult for you, and avoiding doing it in a harmful way for yourself, or setting yourself up for failure. So a lot of our therapists will work through, we used to have 4 sessions of what was called SOAP, which would help them kind of create calendars, set small task lists for yourself, set and accomplish small goals. Okay. And then teaching parents or family members, sometimes spouses, what can you expect? Don't give a list of 7 things. Give 1, let them accomplish that, and then come back and give another set of things that you need them to do, because they've already forgotten about 5 through 7.
Wow, that is incredible. And the hope, we always try to end with hope. We have a little less than a minute left. What can you tell everybody about hope with ADHD? Yeah,
it's such a hopeful diagnosis, because the treatment is so effective, probably one of the more effective treatments that we have out there. And we have stimulant and non-stimulant. So there are options for everyone. And there's also a lot of dietary changes that we can recommend that can help. Omega-3 fatty acids, for example, cutting back on certain sugars. So many things that we can offer to help improve quality of life for our patients with ADHD.
We could go on and on tonight, but thank you so much for joining us, Dr. Johanna Wilson from Hope 419, talking about ADHD. And we're going to be back in just a minute with Sparking the Conversation. Welcome back to Sparking the Conversation. This is the part of our program we call the Memory Moment. And tonight, you actually had something happen to you on the way to the station tonight.
I did.
What happened?
Well, I stopped on the way to the Cove. We'll put in a little plug for the Cove to get some of their tea. And while I'm waiting, there were these two adorable high school girls sitting at the table, and I heard them talking about tattoos and wondering where they should get it and what they should get and would they get tired of it. And I'm quiet, and then I'm like, all right, Danny, I'll go embarrass you, because if she was there, she would have been like, really, Mom? So I go up to them, and I show them all my tattoos and explain to them, my daughter's handwriting, what was on her, and they were so impressed. And, I talked a little bit about Danny, which was very sweet. Explained to them about the cross I had here and the number 8, which is 8 of us in our family. And so I wasn't helping them where to put the tattoo yet, but they had talked all about their arm or their hand. And so I said, this one right here is my favorite. And it is for many reasons. This is the number of days that we had on this earth with Danny. Roman numeral. And don't ask me what it is because I can't see it upside down. But my son and I, Danny's older sister Josh, he has this exact same thing on his arm. So we all have something matching in the family. Yep. But this one I can't see all the time, but I'll kind of glance up, and I told the girls, I said, I feel like I'm just like a really cool chick with this tat, and they laughed.
She's working on her sleeve.
So
Danny
anyhow,
loved tattoos, and we
did.
didn't have any until we lost her, and now every tattoo that we have in our family now means something to
it does. And I know she would have been proud of me doing that, because 3 years ago I never would have gone up to somebody and talk to them about their tattoo. Yeah. So it means a lot. I apologize for ever judging anybody in the world about them, and it's comforting for us, but thank you for listening to that.
Anyway, kind of a cool moment. And those happen all the time with us, and they bring us back to our girl, which is really why we're here and why we're talking about 33 Forever and why we're talking about mental health. So Thanks again for joining us on Sparking the Conversation this week. We look forward to the next time we're with you when we have another great guest here on WMFD.